There's about 40 different conditions that can produce secondary osteoporosis. Sometimes the treatment of those conditions can cause problems. Alcohol. If you're drinking, I mean, it says 3 or more units. Really, we would advocate that have no alcohol. But anyhow, if you're having 3 or more units a day, it is not good for you. As far as your bones are concerned, actually, what amount of alcohol is okay for your brain? That's why I haven't given you any today. Okay, so there's also something called a DEXA scan that you can do. So you can do this test yourself, you can do it for yourself. Sometimes, the definition of some of these things may be slightly sort of, need a bit of interpretation, but you can do this test for yourself. You put in the numbers, choose, there's a UK, another number of other countries, and that gives you a risk of likelihood of you having a future fracture in the next 10 years. And the numbers that are significant are 20 and 3. I mean, you don't need to worry about some of this sort of detail, but it just gives you a little bit of a sense of, what are the key factors. This is just a selection of them, it's not all of them, but it gives you a little bit of a routine in terms of, so the reason why I'm sort of slightly labouring all of this is that sometimes, well, a lot of the times, the patients that we see find they have difficulty going to the GP and asking either for a DEXA scan or for a referral, because the GP says, oh, you do this, you do that, or whatever. Because the evidence is, for lots of reasons, you have to have multiple fractures before your GP, takes you to the next stage of sort of assessment and then treatment. So we got a little bit of a sense of that. So fracs, you can do it for yourself, do it for your family member. If something's more than 20 or 3, then it's significant. But if you're young, even a lower number is significant. And So you've got that now. So you can work out your own risk of osteoporosis. I've given you some of the key things, not everything, but I've given you like an outline that gives you some sense of what sort of things are relevant here. And then I'm just going to quickly run through this, and then I'm done, I think. So what prevents osteoporosis? There are several different things, but in the main, it's nutrition. So pregnancy, other times when you lose bone. To recover that, you have to have nutrition, you have to have calcium, you have to have vitamin D, you have to have protein and so on. We'll go into a lot more detail. There's a lot of stuff on the website, and it applies to children particularly. So if you have families and people that you have access to, there's a lot of stuff on our website about childhood, what you do and so on. Because unless you get enough nutrition, you're not going to be able to reach your potential. So did anyone go on any school trips to churches? Do you remember? Might be quite recent for some of the people here. But ones that I remember going to, all the sort of doors are very small. They were like 4 feet or something. So has our genes changed over the last 2, 3, 4, 5, 600 years?
Yes.
No.
Oh.
Our genes have not changed. You still see in the same way. Your biology is still the same. You still deal with the same thing. The reason why we're taller. The medical students are like 7 feet tall in the hospital. This is the girls. The reason why we're taller is we have less illness, usually less infection, and we have more nutrition. So your bones can be a lot higher. It's like height, it's like a lot of other factors. So if you can improve your nutrition, you will improve your peak bone mass. And you will then have more of a reserve to be able to, because the other thing was, when you went to those churches, they lived till 30 or 20, and that was like a good time. Our age is now 88 or whatever. That's the average age. Some of the people in this room, maybe hopefully a lot longer, because you're not average. You're like way up here in terms of your intelligence. Okay, so nutrition. If there's no nutrition, you haven't got the sort of basic issues, the basic sort of elements to make new bone. And bone is changing. It's not that the bone you had, when you're 20 or 30 or whatever, it's going to last. No, it won't. The next thing is exercise. So it's all to do with muscle. We touched upon this. We said daily exercise. Some of the recommendations say do it X or Y. We said daily exercise. We said focus on the muscle. We can go into some details. We'll be sending you videos. We can, mention some other stuff. Just a couple of the other things is avoid smoking. I mean, that's still quite prevalent, and alcohol. We would say don't have any alcohol. So if you can do the nutrition, the exercise, and then be screened, and remember some of those questionnaires are quite useful, but they're not absolute. So if you really want to know, we have to look at you in more detail, and there's some scans we can do, there's some blood tests that we can do. It's all non-invasive. Doesn't, it's not very painful, it doesn't even cost much. But the picture here is really to sort of emphasize that once you've got the nutrition right, it's all to do with this. And that's beneficial for you in lots and lots of other ways, and we could touch upon that in a minute. So you heard a little bit about why we started the clinic, which was really to be proactive. So we're seeing patients at end stage. We had lots of things happen. You may or may not know some of these figures. 1,150 people are dying every month just in the UK alone from following a hip fracture, just from a hip fracture. And there are 500 hip fractures are about 70,000 or 80,000 a year in the UK. And there's actually 500,000 fractures altogether in other sites. And yet, this is the thing that we find very disturbing, is that only 2 out of 10 people get any investigation. So you walk in there into A&E, you break your wrist, they say, well, there you go, there's a plaster of Paris, you go home. Nobody does anything beyond that. And so the problem that we want to solve is that's basically to reverse and prevent osteoporosis, arthritis, pain, and improve life expectancy. And I'll show you some figures later on. So this is entirely preventable. This is like, there are 200 million people just within this room. Actually, we have reached like tens of thousands of people. And within a bit of information and so on, if there was the planet's focus on this, we can resolve this in a moment, because if we screen people, put them on treatment, we can halve the fracture rate with the most rubbish treatment we have, and we can bring that 9 million fracture per year down to 4.5. So all we need is some focus, advocacy. We're rubbish out. We need your help. But this person that you see here, has anybody seen this person?
Lots of people bent over that.
Yeah, I think if you look, you'll find them. Now that your reticular activating system is seeing this, you will see this person. You'll see them everywhere. Actually, what I might do, just so that really I get into your head, I want you to stand for a moment, if you don't mind. I'm sorry, I know you're like, you're lucky to find a chair, so if you stand, you might lose it. Okay, I just want you to sort of bend forward a bit, and to see what's going on now. Whatever, I mean, just whatever you can do comfortably, and then see where you're going. Now, can you see where you're going?
No.
And what's going on with the rest of you? What's your breathing and your gut and lungs? Can you breathe properly?
No.
But when this is done properly, your ribs are touching your pelvis. This is all preventable. So I see this person, I think I'm responsible. This is me. I'm the person at fault, because I know what all the factors that went to have produced this. And I'm just sitting there thinking, if somebody comes in, I'll sort them out. Come in, I'll sort you out. But I've got to get out there and ask for your help, and you have to then ask for other people that you can sit down. Thank you. So this is entirely preventable. Those 1,100 people dying every month is substantial.